Axios Local is bringing smart brevity to a city near you. Local will deliver scoops, offer sharp insights, and curate the best local reporting. Our events, called Smart Take, will help readers better understand the most consequential news unfolding in their own backyards. With Local, we focus on what matters in your community.
Welcome to our Smart Take virtual event. I'm Tina Reed, healthcare editor at Axios, coming to you from Washington, D.C. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios and #AxiosEvents. Over the next 30 minutes, I will be joined by my colleague, Axios Chicago reporter Monica Eng, and we'll examine solutions around addressing the nation's mental health crisis with a closer look at local initiatives in Chicago. Our first guest is United States Surgeon General, Dr. Vivek Morthy, joining us from Washington, D.C. Welcome, Dr. Morthy.
Thanks so much, Tina. I'm glad we're doing this.
Well, I would love to start by talking about one of your latest projects, which is your podcast.
Yes, well, that has been a lot of fun to do. We started a podcast recently called House Calls with Dr. Vivek Morthy, and it's a series of conversations that I'm having with people of different walks of life, with the understanding that it's our conversations with each other often that can lead to understanding and that are the foundation for healing. It's a lesson I learned early on in life from my father, who was a doctor, and one that I tried to incorporate into my own practice of medicine later on. But in these conversations, we explore healing through a bunch of different lenses, looking at it through the lens of food, about how we manage major challenges in life like illness. And there's more and more to come. So we've got a couple episodes out already, but I'm excited for people to hear these conversations that I've been having with folks from around the country.
I thought it was interesting, your first show when you were speaking with acclaimed chef Jose Andres, you opened with a question about him being able to be his authentic self. What does authenticity matter in terms of mental health, and why is the Surgeon General talking about it?
Well, it's such an important question, Tina. And I think as human beings, we are all at our best, and we all feel our best when we're able to be who we are, when we don't have to pretend to be someone else or hide behind a different image. But as life goes on, whether it's when we're young in school or later on in life, so many times we feel like we've got to exist in a different mold or try to be somebody else, and that's stressful. It puts a strain on our mental health and well-being. And so part of the focus on authenticity is a focus on getting back to who we really are. And as human beings, I believe we have a few fundamental needs, regardless of what culture we come from. We all want to be seen and understood for who we are. We all want to know that we matter, and we all want to be loved. And the extent to which we can experience that is the extent to which we feel better and do better. And that's directly connected to our mental health. This is why I've worked on youth mental health. And in December 2021, when I launched a Surgeon General's advisory in youth mental health, we wanted to focus on increasing access to treatment, focus on prevention, focus on eliminating the stigma around mental health. But we also wanted to make sure that we are creating an environment where kids can be themselves and be accepted for who they are. That matters tremendously for our mental health and well-being.
And we do have what's been called a youth mental health crisis. How did we get here?
Well, we certainly didn't get here overnight, Tina, but let's talk about where we are. And even before the pandemic, for example, we had a crisis when it came to mental health in our kids. In the decade before the pandemic, for example, there was a 57% increase in the youth suicide rate. We know that around this time as well, it takes on average 11 years from when a child experiences symptoms to when they actually get access to evidence-based treatment. 11 years. That's an extraordinary amount of time in the United States of America. But the other number that sticks in my head is the number 44%. That's a percentage of high school students who today say they feel persistently hopeless or sad. And high school is a time where we want kids ideally be feeling good about the future, optimistic about what's to come, but nearly half of high school students don't feel that way. This has been building over time, and I think it's a consequence of several factors. One, we know that bullying, both online and offline bullying, has been a real challenge for young people. We also know that many young people struggle with loneliness and isolation at record levels, and this is something that's been largely underappreciated, but is very much connected to anxiety, depression, and other mental health challenges. And finally, we know that for many young people, the experience of technology has not always been universally positive. In fact, when I talk to young people all around the country in roundtables, and small group meetings, they often tell me that being on social media is something they feel they have to do, but it often leaves them feeling worse about themselves as it drives this culture of hyper comparison, where they're constantly comparing their average days to other people's best days, and they come out feeling worse about themselves. You put all of this together with the broader challenges young people are looking at in society, from climate change to violence to racism, and the list goes on. Many young people tell me they don't necessarily believe that the future is going to be better than the past. And so we've got to look at these broader set of strains that young people are under, because not only do we have to address those, but we also have to make sure that when somebody speaks up and asks for help, that help is available. And for too many young people, it's not right now, and we have to change that.
And then this is part of a bigger problem, right? With when we think about just the broader population and how people are dealing with loneliness right now. How do we kind of think about what's been happening in the broader U.S. population through COVID and how we kind of come out of this?
Well, there's no question, Tina, that the last 2.5 years of this pandemic has put extraordinary strain on people across the country of all age groups. And that's taking a toll on the mental health, of our country. And we know from natural disasters that mental health takes a hit, and that can often outlast, the last building that's rebuilt, to the last, pile of trash that's recovered, like in a natural disaster. With COVID, I worry it will be similar, that the mental health impacts of this pandemic may last for years unless we step up and take action now. Taking action now means expanding access to treatment, not only in clinics and hospitals, but bringing treatment to where people are through telemedicine and through school counselors. It also means investing, finally, in prevention programs, particularly in our schools, programs that we've known about for years, programs that have evidence behind them, but which we haven't put the money and effort into actually expanding and making available. And it also means investing in social connection and community. We know, for example, that when people feel lonely and isolated, that contributes to an increased risk of not only depression and anxiety, but also physical illnesses as well, like cardiovascular disease, premature death, dementia, and the list goes on. And if you look at the latest polls on loneliness and isolation, according to some of these polls, nearly half or more of the population is struggling with loneliness and isolation. That was true even before the pandemic. So we have to get started on the urgent work of not only increasing access to treatment and investing in prevention, but rebuilding social connection and community in our lives. That's going to be vital to making sure not only we get through this pandemic and support our mental health, but also ensuring that when the next challenge arises, whether it's another pandemic or another health challenge we're facing, that we're able to stay together and support one another, which is so vital for response efforts.
Now, going to a question that we got from a few audience members, they wanted to hear your thoughts on this problem we have of gun violence right now, and how you think about the mental health connection to that, and how you think about the problem of gun violence as a public health issue.
Well, Tina, I'm glad you asked, because this has been on so many of our minds, especially this year, because we've encountered story after story of communities that have been devastated by gun violence. Gun violence, unquestionably, is a public health emergency. We just haven't been treating it as such, and we have to approach it with renewed urgency. I've been encouraged to see the bipartisan efforts in Congress to help move us a step closer toward real solutions, but we can't let that be our last step. There's a lot more we have to do. Let's talk about how this actually intersects with mental health. Many people may be under the assumption that mental health challenges are what drive gun violence, and that's actually not entirely the case here. If you look at gun violence and divide it into deaths that result from suicide, which are a little bit more than half, in fact, of gun violence-related deaths, clearly there's a mental health component there, and we need to be getting to people earlier, providing them with support and care. But when you look at the homicides that are the component of gun violence, very few of those are actually driven by or committed by people who have serious mental illness. In fact, people who are struggling with mental illness are much more likely to be the victims of violence than the perpetrators of violence. And so while we do need to invest in mental health, we also have to address the broader issues that drive gun violence in our country, to make sure that we take steps to ensure that dangerous weapons don't get in the hands of people who are an imminent threat to themselves and to other people. We've got to invest in safety programs. We've got to invest in prevention more broadly, which comes back to, again, also rebuilding our investments in social connection and community. Keep in mind, many of the people who are perpetrators of mass shootings, we find are often lonely and isolated as well. So we've got to approach this problem of gun violence on multiple levels, but as a public health problem, because that's exactly what it is. And finally, I'll just say this, this is fresh on my mind, Tina, because I just came back from Uvalde, where I visited with community organizations, healthcare workers, and most importantly, with the families of who lost children in this terrible tragedy that unfolded at Robb Elementary School. And the impact, the mental health impact of gun violence on those families, but on the broader communities is unmistakable, and it's heartbreaking. When I talked to the community, they told me that children in Uvalde now, so many of them, won't walk into buildings without looking for an exit first or knowing how they can get out. People are scared to go to events because they worry, is this going to be another time where somebody pulls out a weapon and fires upon others? The ripple effects, mental health impacts of gun violence are just profound on communities. And I know this as a doctor who's taken care of victims of gun violence as well. For years and years afterwards, the individuals and families really struggle. So we have to keep that in mind, because that informs, in my mind, the urgency with which we have to address the challenge of gun violence in our country.
Well, in the last few seconds we have, I did want to get to the biggest news of the last few years, which has been COVID. And Axios and Ipsos just came out with a poll finding that a lot of Americans are still really tuning out new COVID information, even as we're seeing the spread of the illness. Could you talk a little bit about how you see that kind of playing out in the fall then, if Americans are really tuning out your messaging?
Well, I think it's very understandable that people are fatigued at 2.5 years into a pandemic. I think we all feel some element of fatigue. What encourages me is that we are in such a different place now than we were 2.5 years ago. We have vaccines that we know have saved lives and boosters that can extend those benefits. We have more treatments now than we've ever had before, and they're highly effective at keeping you out of the hospital. We now have masks and tests which we know work and which have been freely distributed by the government to people across the country. So again, more tools to actually save our lives and keep us out of the hospital. My hope is that more and more people can utilize these tools, because I don't want the hard work and the hard-won lessons of the last 2.5 years to be lost. And it's one of the reasons why, as we go into the fall, we are going to continue working closely with community organizations, with faith leaders, with local doctors and nurses, with teachers and educators, to make sure that people can get information easily where they are. As kids get back to school, for example, we want parents to be able to hear accurate information and that they can use to keep their kids safe from their schools and their local directors of public health. So we'll keep working on that, but we want to make sure that people can get back to their normal way of life. People have been doing that more and more over the last few months. We can keep that going if we utilize the tools that we have.
Well, Dr. Morthy, thank you so much for your time today.
Thanks so much, Tina. It's good to be with you.
And next, we have a View from the Top segment with Mia Boykins.
Thanks, Tina. And thank you to our sponsor, Walgreens, for making this conversation possible. I'm Mia Boykins, a global entrepreneur and speaker. It's my pleasure to be here today. Now joining us from Deerfield, Illinois, is Executive Vice President and Global Chief Human Resources Officer at Walgreens Boots Alliance, Holly May. Welcome.
Hi, Mia. Great to be with you to discuss this important topic.
Thank you for being here today. There is a much greater focus in the workplace when it comes to mental health, and a greater calling on employers to do more to support the health and well-being of their employees. What is Walgreens doing to help ensure access to information, services, and other resources its team members may need?
No, it's a great question, Mia. Actually, I'm very excited to talk about our recently launched program, Be Well Connected, which is a program we launched in May during Mental Health Awareness Month for our team members. And that's how we refer to our employees. And it's really a three-pronged approach. We recognized that a one-size-fits-all offering was not going to be right for our people. We listened to them about what they needed, and we delivered. So the first part of that is our already existing EAP solution, which is Life 365, where we offer 5 free mental health counseling sessions to our team members, as well as tools and resources. The second is Journey Live. So this was new for us. It's a web-based platform and app that offers both live and on-demand classes where our team members can interact with each other and expert instructors on a variety of topics, ranging from anxiety to sleep deprivation, and can interact with the instructors as well as their team members to talk about things, what's bothering them, and getting the resources they need to improve. And then the third solution is called Indieflix. And we refer to that as our own Sundance channel for WVA. And it releases a variety of documentary films on topics such as social media, addiction, and other mental health topics of the moment. And we hold a bit of a premiere for each of these films with internal panel discussions. So with these 3 offerings, it was important to us to not just offer them to our team members, but also their families. So these are resources that don't just stop in the workplace. We're thinking about the whole person and delivering for them what they need, that goes beyond the 9 to 5 and supports them in their personal and professional lives.
I'm happy to hear that Walgreens is being proactive in protecting the welfare of its employees. Historically speaking, stigma has been a barrier to people seeking treatment or care, especially in the workplace. What can leaders do to help break down that stigma, encourage an open dialogue with managers and others, and make people more comfortable seeking help through their employee?
As a people leader, I've always believed strongly that authenticity and vulnerability are key in how you lead. It's, not about showing up perfect every day, showing the brave face. I think the pandemic taught us a lot about that, because, when you show up as your whole self, and are realistic about your own challenges, you're giving your team permission to do the same, to not feel like they have to show up with a brave face, to be honest about, things and challenges they're dealing with, both personally and professionally, to build that trusted relationship between manager and direct report. So you can have those authentic conversations, not only about what's happening, but how you as a people leader can support that person, both with their work schedule, workload, how they get their work done, and resources and tools that we can offer as an organization that might assist them with their whole life, not just what happens between 9 and 5.
Definitely. Thank you for those suggestions. I'm sure these measures can cause major improvement in several workplaces. Nevertheless, beyond just a healthy and productive workforce, what do you feel are the benefits to employers by making more of these services available and showing employees that you, as an employer, are committed to their health and well-being?
I think that's a really important question. And I think, as we look at the environment around us, it's never been more important to think about the community you're creating as an organization, about thinking about work-life balance post-pandemic. I think we've all seen the stats in labor forces throughout the US right now and abroad globally, that there are real challenges that companies are facing. And to really embrace the whole person. And that's been our team member vision at Walgreens, which is caring for our team members as whole people. I think the more you invest in your people, you listen to your people, you understand what they need, you create a strong community. And with that, strong engagement. And at the end of the day, that's what's going to drive, high performance culture and a winning team. That's really necessary to get the results you're looking for as an organization. You create a strong employer brand, and you also create lifelong customers in the process.
Yes, it's important for all employees to feel included. Many times, people find it difficult to have these kinds of conversations. What is your approach personally when it comes to having these kinds of discussions in the workplace, whether with your team, colleague, or others?
I often use the phrase that my leadership motto is to be unapologetically human. So you never know what's going on in someone's personal life, and the phrase behind the sometimes behind the brightest smiles lie the saddest hearts. So something I always think about is to be kind, and I encourage our leadership to do the same in all circumstances, whether it be providing constructive feedback, whether it be having one-on-one conversations. It's really important to care for the whole person. It's really important to build relationships of trust. And I think that's just a leadership tenet that all should be aware of, mindful of on a daily basis.
Thank you so much for joining Axios, Holly.
Thank you. It's great to be here.
Next, over to my colleague, Monica Eng.
Thanks so much, Mia. I'm Axios Chicago reporter Monica Eng, and our final guest is Chicago Public Health Commissioner Dr. Allison Arwady. She's joining us from right here in Chicago. Thanks so much for joining, Dr. Arwady.
Thanks for having me.
So let's get down to it. First question, Chicago released a mental health framework in 2019 with goals of expanding services, preventing violence, funding crisis response. And well, here we are 3 years and one continuing pandemic later. How much of that got done and what are the biggest challenges?
Sure. So I am so proud of the progress that we have made in the behavioral health space. A lot of the attention during COVID, of course, was on COVID for the public health department, but we've made just as much progress truly when we're thinking about city approaches to mental health. Just to be concrete about it, if you look back to 2019, we were only serving about 3,500 Chicagoans with city funds for outpatient mental health resources. We've gone from 3,500 in 2019. This year, we're on track to serve 60,000 Chicagoans with mental health care, and that's regardless of their insurance status, their income, their immigration status, or ability to pay. By the end of this year, we anticipate having at least one clinic that we are providing funding to in all of Chicago's 77 neighborhoods. We've also importantly, for the first time, really moved care out of clinic walls. So we've worked hard to make sure that victims of violence, and not just direct but indirect victims of violence, can be more directly linked to mental health supports after an event. We've worked to embed mental health professionals in the 911 response for the very first time. We've funded bringing mental health resources into homeless shelters and done more to bring resources out of clinics to people who may have more serious mental illness. And then finally, we've worked to really coordinate the system. We knew the biggest barriers here in Chicago where people said, I had mental health needs, but they weren't met. People didn't know where to go, or they were worried that they'd have to pay for them and wouldn't be able to afford it. So we've made major progress on all of this. The biggest challenge is always workforce, where we don't have enough mental health professionals, especially that look like Chicago, and across all of healthcare, we're looking to continue to really build that. But I'm very proud of the investments that have been made, and that those investments, even during the time of COVID, have already paid off significantly for Chicagoans.
There's a lot there to unpack, and I hope we'll get to it. And one of those is that kind of care for folks who've dealt with trauma in the wake of gun violence. I recently went and talked to some gentlemen at Stateville Correctional Center, and I asked them what they would do if they could be out trying to prevent gun violence. And they said the number one thing they would do is try to prevent the next shooting by providing trauma care, trauma-informed mental health to those left behind. Now, first of all, what is trauma-informed care, and what kind of resources would we need for something like that?
Yeah, so when we think about trauma-informed care, this is something that we were actually working on prior to COVID at the health department. Chicago is unusual in that we directly operate some mental health clinics as a city, in addition to, of course, coordinating many others. And we've very much on purpose have designed that network that we're funding. We call it our Trauma-Informed Centers of Care Network, or our TIC network. And the idea of trauma-informed care is that instead of asking people what's wrong with you when you're having a challenge, it's asking what happened to you. How do we help you unpack that? How do we not inadvertently bring up memories or create spaces that can re-traumatize you after an event? And so just to give you an example of what some of this looks like, we've been building many more resources for victims of violence. So the idea is when there's been a violent event, gun violence certainly comes to mind first and foremost, but you think about domestic violence, you think about children who may be witnessing violence in the home. There's a lot of indirect victims of violence as well. And we've been working to really make sure that already we had a program where if somebody is shot and dies in Chicago, that right away we're working to get resources in, to pay for legal needs, to give some of that support, to work on decreasing retaliation. But I think so much of this is thinking beyond the immediate victim and their family to actually having a conversation more broadly about trauma-informed care and mental health, because health is mental health. Mental health is health. And too often we've thought about these differently. There can be different stigma around them. Everybody is carrying around some history that impacts the way they see the world. And the more trauma that you've been exposed to, the more skills you can actually learn that can help you be productive. And we want to have a no wrong door approach. So whether it's a teacher in school noticing someone's having problems, whether it's someone working in an outreach organization, we really wanted a network where we can connect those people right away in a way that doesn't have stigma, and say all of us deserve trauma-informed care.
So as we heard from the Surgeon General, 988 launched this weekend to try to divert mental health crisis phone calls from 911. And similar moves were already happening in Chicago with this care pilot that sends mental health professionals on these emergency response teams. The city recently released some of the results of nearly a year of that pilot. What did we learn about mental health crisis interventions in this almost year?
Yeah, so we've been really excited about the pilot of this CARE. It stands for Crisis Assistance, Response, and Engagement. And it recognizes that when people are calling with a mental health crisis, historically, most people have only known to be able to call 911. And the default response, even for a mental health crisis in Chicago and around the country, has been police. Ideally, you would like to have this be treated first and foremost as a health concern. And so we've learned, for example, that embedding 911 professionals in the call taking center, in our 911 center, providing support for the people taking the phone calls, helping screen calls as they come in to say, yes, this would be a group that's potentially applicable, and then to think about different ways of responding that don't include police. So we've learned that this is doable, that it requires a lot of cross-department work. The health department working with the police department, working with the fire department, which is our emergency medical service, and working with the 911 call takers. But we've seen very clearly that we can do this in a way that is safe, that helps divert some of the police resources to more direct law enforcement needs. And I'm really pleased that 988 is launching in the same way. Right at the beginning, 988 is just an easier number for everybody in the country to know who you can call when you're having a mental health, a substance use, a behavioral health crisis. Down the line, we of course would like things like the CARE pilot to link to 988. That's a longer term goal. But it's all about making sure we can quickly get the care to people that they need, and that we don't separate health and mental health in the same way.
Now, one of the biggest challenges in terms of mental health access has been stigma, and the city has the Unspoken program to help reduce that. How has that played out over the last couple of years?
Yeah, so after talking to a lot of Chicagoans who have lots of opinions about where to focus, so much of the conversation was coming back to how do we turn mental health concerns from something that are unspoken in Chicago to something that we talk about very openly. People are used to talking about their physical health at this point, but not so much their mental health. And so unspoken is the overarching brand and the way that we think about all of these different parts of our mental health work. We have a website that you can look and see some of the things that we've created with Chicagoans talking about their own mental health journeys. Really thinking again about where we know there are certain demographics that may be less likely to seek out healthcare, and really making sure that in every setting, whether it's working with athletic coaches, whether it's working with counselors in religious settings, whether it's working with other types of community leaders, trusted adults for kids, that all of them have some of the basic training around mental health to turn this into something that we talk about. We want folks to feel comfortable raising mental health concerns themselves or recognizing warning signs in others. And we want to be really clear in Chicago that where you've got someone who's needing more help, we can get that person connected to a higher level of care. So we're talking a whole lot about mental health, and we don't want it to be something that remains unspoken.
Well, in about the 20 seconds we have left, I know that there are a lot of programs that employers, as people are coming back, can offer to help their employees access mental health services better. What have been some model ones you've seen?
Yeah, it's been really interesting, even for City of Chicago employees, making sure people have a good understanding if they have insurance, how you access that, what does that actually look like? Helping people, there are still people who say, I don't want to go to a specific mental health clinic. So we've worked to make sure that there are mental health resources built into primary care, built into food pantries, built into other social service centers. Again, this no wrong door approach. And I think that if we look at the private sector, we've not always been as open talking about mental health needs, but they are here and they are just as strong. And during COVID, I think everybody's mental health was affected. And so one of the outcomes, I think, coming out of the acute phase of COVID is that we're all much more, I hope, used to talking about our mental health struggles just as we are our physical struggles. And so I think we take a page from that employee health means creating spaces and support for whatever your employees are going through. And I think that's what CDPH has also been trying to do.
Thank you so much, Dr. Arwady.
You're welcome. Thank you.
Thank you all for joining us this afternoon for another virtual conversation that has made everyone smarter, faster. For more information and to sign up for any of our Axios local newsletters or Tina's Vitals newsletter, visit axios.com/newsletters or the Axios app. Thank you all for joining us, and we will see you on axios.com.